Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about 3D CRT. Okay, what is 3D CRT? As I told you already, we will be seeing the radiation therapies. What are the recent techniques in radiation therapies? Now, this is a kind of the third type of 3D, third type of radiation therapy, that is 3D CRT. 3D CRT is a cancer treatment that allows doctors to direct radiation beams to conform to the tumor shapes. Okay, 3D CRT is a cancer treatment therapy that allows doctors to direct radiation beam, to pass the direct radiation beam to conform the tumor shape. Okay, to identify the tumor shape. Okay, to identify the tumor shape, this 3D CRT is specifically used. In the past, beams only matched the higher height and width of the tumors and exposed healthy tissues to radiate. Okay, in the past, beams only matched the height and width of the tumors and exposed healthy tissues to radiate. Okay. Now this 3D CRT is being a very effective one, where the 3D cancer treatment is allowed for the doctors to identify the tumor cells in what kind of shape it is, to identify the shape of the identify the shape of the tumors in the body by using the direct radiation beams, by passing the direct radiation beams, which helps him to identify the cancer which is used for the cancer treatment. Okay, before this 3D CRT, the beams only match beams which has been passed through the body will matches only the height and width of the tumors and will expose to the healthy tissues also. Thus radiations will be passed not only to the tumor cells, it will be exposed to the healthy tissues also. To rectify that, we are going for 3D CRT. Okay, what are the advantages of 3D CRT? Allows for the simulation of the patient's treatment without their physical presence after the CT scan is obtained. Okay, allows for the simulation of patient's treatment without their physical presence after the CT scan is obtained. That is treatment modifications. Systems allows for better dosimetric optimizations above that which is achievable with geometric optimization alone. Okay. What are the advantages of 3D CRT is that which allows for the simulation of patient's treatment, which is used for the patient's treatment without their physical presence. Okay, without their physical presence, it can be used for the treatment it can be used for the treatment modifications by using the CT imaging. After CT scan image is obtained, by seeing the CT scan, we can come into a clarification that what kind of treatment to be produced. Okay, for that this 3D CRT treatment is 3D CRT therapy is used. What are the limitations of that? Knowledge of tumors extent CTV is often not fully discernible. Okay, knowledge of tumors extent CTV is often not fully discernible. Patient's motion. 3D CRT, where the patient since it is similar to the CT, where the patients cannot stay for a longer time to have the therapy procedure, so we'll have some disturbances or some movement. If the patients have some disturbances or movements, we will not be able to identify any tumors clearly. Okay. Biologic response of tumors. Once the patient have any disturbances or uncomfortness, the biological response of tumors will be the response of the tumors cannot be identified clearly. Disadvantages. What are the disadvantages we have? Insensitive to classification and bone structures. Okay, insensitive, which is not sensitive to the classification and bone structures. It can give a different kind of output also. Okay, longer time, it takes longer time. Okay, the longer time, and it also produce artifacts. Why? Because the patients cannot stay in the same position for a longer time, so artifacts can be found in the 3D CRT images. Side effects of 3D CRT. What are the side effects we can find? Radiation pneumonitis, esophagitis, fatigue. Okay, radiation pneumonitis, esophagitis and fatigue. What is the radiation pneumonitis? An inflammation of the lungs that typically starts within 2 or 3 months of the start of a radiation therapy. Its symptoms can include a dry cough, shortness of breath and long grade fever. Okay, these are the side effects which can be affected by taking 3D CRT. Then next is esophagitis. Occurs when the esophagus, that is food tube that runs from the throat to the stomach. Esophagus is the food pipe which runs from throat to stomach, becomes inflamed. This condition typically starts about 2 weeks after the beginning of treatment and usually disappears about 2 to 3 weeks after the treatment is completed. Once the 3D CRT procedure is taking out, these are the difficulties will be facing by the patients. Okay. Next is a feeling of weakness or exhausted that does not go away after resting also. Okay. It takes a feeling of weakness. We'll have a very weak or a very exhausted stage. Okay. Fatigue is typically most several 2 to 4 hours after the radiation session. It may also peak between 3 to 5 weeks of a treatment. After this treatment, it can lead to 3 to 5 weeks of fatigue also. These are the side effects which can be caused by 3D CRT. Thank you.